Good morning, good afternoon. Jerry Dreesen here with another Thursday Live. I want to welcome you to our three-part series. We've got our bone, our brain, bone, and body series. And for those of you that are joining us for the first time, this is the Association of PEMF Professionals. We're an international organization all about certifying, teaching things about PEMF. And I've got some information at the end of this recording for you to take a look at. Today we're live, so if you do have a chance, you want to jump in and add a comment, feel free to do that. And like and share us. And with that, I'll get going right through our program today. And a lot of people ask if PEMF is FDA approved. And there are three things that back when PEMF first started coming out that the FDA did approve. And one of them was bone health. And I'm going to go through some of the research that's out there. And you will be able to check that out too on our website, PEMFprofessionals.com. And you are going to learn a lot about PEMF and bone. So right out of the bat, PEMF has been FDA approved to assist in bone growth and healing. PEMF has been used since the 1970s for bone healing, but there's still much more specific research that must be conducted to establish protocols for different injuries and damages. So in other words, where do we place it? How long do we put it on? How much power as far as Gauss or Tesla? The distribution of that. So is it a small area just over where the break is, or the whole system? So everybody's trying all the different parameters, and that's why we're not seeing a lot of super definitive research yet. Although what you'll see in the samples that I have definitely walk us through that. So if you are interested in learning more about our website and where you can find these articles that I'm going to be talking about today, when you go to our website, it's under the education tab, and then you'll see PEMF research. And when you click on research, then you'll have this other page, and right here's where you can tap in your search. And I did FDA bone health is what I did. And when I tapped on that and then hit return, then this popped up, and there were returns on a lot of the different bone and PEMF therapies. So with that, I'm going to walk through, I think I have three to talk about today. So the first one is the pulsed electromagnetic field effect on bone healing in animal models, and it's a review of its efficacy related to different types of damage. And the take home from this article is the versatility of using PEMFs in those situations in which bone metabolism can be compromised appears evident in the light of the results shown. In fact, it has proved useful in situations where the bone has been directly damaged in a traumatic way and in conditions of bone metabolic impairment, such as osteoporosis induced by diabetes, corticosteroids, ovaryectomy, as well as the prevention of osteoporosis from disuse. So this study shows some really cool outcomes based on what they were using. And again, those of you that have PEMF businesses, these are some things that you can have ready to go. You download the article, some things you can put on your website. This is all for you. Part of what we do for our members and those of you that are wondering about, how all this stuff works. I know in my clinic, for example, if somebody's been in a car accident, I'll be talking about using it on the brain like we did last week. If they were in a MTI where they get, a concussion or something, we'll have PEMF on their brain. If they have bruising on their body from their knees or shoulders, if they get T-boned, then again, we'll put it on their body over the area of the injury. And PEMF does a great job of decreasing pain and problems. And even if it's chronic and old, I had a patient come in yesterday, shattered his pelvis 40 years ago. And he has a problem getting up and moving around, as you may know. And we put the PEMF on his low back for 30 minutes on low. So basically, what I mean by low is on mine, I have a dial as opposed to just a digital. Mine's more analog. But I turned it up until he could just start to feel it, and then I backed it down a little bit. And it didn't take much because he had so much inflammation that was in there. But after 30 minutes, he stood up and he says, I feel 25, 30% better, which meant we took the sharp edges off. And then later that day, I looked and he had put a 5-star review on our clinic on how good he felt. So we also did his knees too. And so that was great. So it really does work, and we're seeing really good results of that. But this is the article, this is the backup system where if somebody says, well, how does that work? You don't have to be a scientist and explain it. And you can say, I don't know exactly how it works, but here are the leading articles that talk about what they do and what results they're getting. So you can definitely use these articles. Another article is bone growth stimulators. This is an executive summary from the FDA themselves, and it was published in 2020. So probably their most recent production of information. And with this comes a really cool graph. So those of you that are watching live, you can take a screenshot of this. And again, it's going live on multiple channels, so you can go back and look at that and grab this, or you can just grab the article on our from our website. But the FDA executive summary, it was prepared for their meeting in 2020, and a reclassification of non-invasive bone growth stimulators. So non-invasive means that you don't have to cut the person open or inject them with anything, which is a selling point when you're using PEMF. What's great in the clinic system is people don't have to gown up. They come in wearing their street clothes. You put it right on top of their clothing. You don't have to peel anything back and directly apply it to the skin like you would with a lot of the physical therapy devices like ultrasound or TENS unit, where you actually have to have contact with those areas. And what they said in this is, in accordance with Section 513 of the Food, Drug, and Cosmetic Act, a device should be classified in Class 3 if insufficient information exists to determine that general controls and specific controls are sufficient to provide reasonable assurance of its safety and effectiveness, and the device is purported to represent to be for a use in supporting or sustaining human life, or for a use which is of substantial importance in preventing impairment of human health, or if the device presents a potential unreasonable risk of illness or injury. So PEMF, what's great about it is there are devices out there that have controls. So it's not when you put it on, you flip the switch, and it's whatever it is, whatever it is. And so that's what they're trying to define here. And they've come up with a really cool chart where we start up on the upper left. Are general controls sufficient? And if it is, then it's Class 1. If no, then is there life supporting or sustaining substantiality important to the human health? And again, if it is, then it jumps into the diamond here. If not, then is it a potential unreasonable risk? Again, if it is, then is it sufficient info for special controls? And again, here's where you get the classifications and, of course, sufficient information for special controls. So here's how the classification goes. And so your manufacturer of your device should have one of these classifications on there. And if not, get a hold of them and ask them what it is, because the FDA has it all laid out as far as the flow chart. And if you have any questions, if your machine doesn't come with a classification, get a hold of us and we'll help walk you through this diagram, and we'll find out what your classification is. And then there is another one that I found on our system too, where early application of pulsed electromagnetic field in the treatment of post-operative delayed union of long bone fractures, perspective of randomized controlled study. So what's cool about randomized is you can have a sham, and which means you don't know if you're getting it or if you are getting it. So that's what's great about a double-blind study, and you get really good information from that. And what they found is that fracture patients treated with an early application of PEMF achieved a significantly increased rate of union and an overall reduced suffering time compared with patients that receive PEMF after 6 months or more of delay union as described by others. So this is the most important, because if you know the physics behind bone, whenever there's an injury, just like on the skin, it's really cool. Bone is like skin. When you cut it, it bleeds, it scabs, and then it heals itself. Bone does the same thing. When it breaks open, it initiates bone bleed, which is basically the marrow. And then that stimulates two different types of cells, which are osteoclasts and osteoblasts. And the osteoclasts, they go and they chew up all the bad bone or bone that, is laid down incorrectly. And then the osteoblasts come in and they rebuild the bone in the area where there's a problem. And I don't know if you've ever seen a bone scab when there's been a break, but it's kind of a swelling around the bone itself. You can see it on x-ray, but that means it's in the process of healing. And what PEMF does, it increases the rate of that union as far as bringing things together. So great stuff for that. Even in sports, I'm thinking like hockey, when you get, whacked with a stick and you got a bone bruise, PEMF is going to go in and help that out a lot. So it's not talked about that much, but there is a lot of PEMF use in the sports areas, especially when there's been injury. But if you know somebody that, broke a leg, an ankle, an arm, especially kids, PEMF is perfect for that. So that's some of the information that we have on our website as far as learning about PEMF on our research side. Definitely go back in there. I'll bring that back up again. But go to our website under education, a PEMF tab, and then you can do any kind of search. You can do, bone. You can do, there's a couple other ones that are out there that we haven't brought in yet, because we're still waiting to make sure that they're vetted properly. But we're constantly updating with as new of research as we can. And so with that, I will conclude today's talk about FDA approval of PEMF and regarding bone health. And those of you that are watching, thanks for being a part of it. Again, this is part 2 of our 3-part series on PEMF. Last week, we talked about brain health. So you can go back into our archives and look at that. Today, we're talking about bone. And then next week, we're going to talk about PEMF in the body and the things that are out there. Again, these are all things that you can archive and use. And like I said, put on your website. Did you know that PEMF helps with the brain? Did you know that PEMF helps with bone? Did you know that PEMF helps with body? And we're also in the process of creating things for our members that you can also add to your feeds, your Facebook feeds and your Instagram, that'll start generating conversation and increase your ubiquitous footprint that you're building with your device and your business. So some things that you can do to help us out is to like and share all of the things that are out there that we're doing, because the algorithms, the LinkedIn, the Facebook, YouTube, Instagram, anytime you like and share one of our things, it gets our information out there even more. So we really appreciate those of you that have been doing that. You can also visit our blog and you can share that as well. That helps us out. So no like and share. If you are seeing this video for the first time, or you've been thinking about becoming a member, like I said, we're in 17 different countries now. We've got over 1,000 members and building. Last year, we had a lot of new people join just because of the things we're doing today, like this live, but also reaching out. And feel free to give us a call and email us at info@pemfprofessionals.com. You can go right in on our website, which is going to be getting an upgrade. We're going to be seeing that this year too. We're just about, I think we are weeks away from launching our new look. So it'll have a lot more robustness about it. And we'll be talking about that too in the live. So I want to thank you again for your time today. And with that, I wish you a great week. And feel free to reach out to us, reach out to me if you have any questions. We, of course, watch the Facebook questions and jump in there and help you out too. So with that, take care. Have a great day.